Hello, everyone. This is Megan Manzano, the Senior Custom Content Specialist for Pharmaceutical Commerce and Pharmaceutical Executive. Today, our conversation will be centered around a simple truth with enormous consequences in specialty pharma. The first dose is everything. For patients starting self-injectable therapies, that first experience is more than a clinical step. It's a psychological inflection point. Confidence or fear, momentum or delay, commitment or quiet abandonment. And here's the hard reality about this. 14 to 20% of patients who receive prior authorization and are shipped the first dose never get the second dose. Not because the drug doesn't work, but because uncertainty, anxiety, or lack of preparedness gets in the way. That's where Noble's SureStartRx program comes in. SureStartRx reimagines patient onboarding by delivering high-fidelity remote demonstration kits directly to patients through specialty pharmacies before that first injection happens. These kits include realistic training devices, clear instructions for use, and video support, as well as digital assets allowing patients to practice safely at home and build confidence before they ever touch their real medication. Research Noble conducted showed that when comparing standard of care alone to standard of care plus a demonstration kit, the impact was clear. Patients started sooner, adhered better in the short term, and stayed on therapy longer. Today, we're going to be joined by Noble's Director of Patient Engagement Services, Sean Glynn, to unpack why confidence is such a powerful driver of initiation, what early drop-off really costs brands over the life of a patient, and how SureStartRx helps protect both patients and patient lifetime value. Thank you so much for joining me today, Sean.
Thank you, Megan. Thank you for having me.
So we're going to set the stage here and get our audience acquainted with what we're going to be talking about today. So Sean, your team often says the first dose is everything. Why is that moment so fundamental, not just clinically, but behaviorally?
Yeah, I mean, you kind of hit on a lot of it in your introduction there, Megan. I mean, we do believe that first dose is everything, right? I mean, that this first dose is the point at which, momentum is built, for the patient to start their journey with their therapy, right? For some patients, it's been a long buildup, to this point, if in the case of, rare disease. But those first couple of doses, that window of initiation, as it's called, is just so critical because there's what we found is that there's just way too many patients that can't get on with those first couple of doses, and that's manifesting in, clinical problems for the patients down the line because they're not getting the potential therapeutic benefits of their medication. It's manifesting in problems for the pharmaceutical company who's done all this work to get a program on, through market access and on formulary. Specialty pharmacy has upfront, costs in trying to get patients verified, et cetera, as you said in your introduction. And then there's obviously burden to the HCP because the patients aren't getting on with their therapy, which means they're more likely to be back in clinic sooner than later.
That's a really great point. And I think about even people in my life who have gotten specialty therapies, but either abandoned it because it seems too complicated, or maybe there's a gap between actually getting the medication from their doctor. So I think that's really important. And I want to think about the reality of this situation, this hesitation that you're describing. How big of a problem is it in the real world?
It's a bigger problem than most folks are kind of tuned into. I mean, this is obviously something that we spend a lot of time on with Noble. But about 14 to 20% of patients, as you said in your introduction, who go through the process of getting their benefit verified, their prior authorization complete, they're shipped the first dose. But 14 to 20% of those patients never get the second dose, right? Now, there's a myriad of reasons why that might happen. Oftentimes, it's financial for a patient. Can they handle the copay? What's going on with their deductible? But for a lot of patients, it's really about building confidence, right? That confidence to begin, perform a self-injection. It's not an easy thing for a lot of patients. Needle phobia, needle fear, anxiety, is a real thing for a lot of patients. And there's some patients, unfortunately, that just without good training can't make that next step and get on with those first couple of injections.
I think about how, this is already so detrimental to patients, but I would love to hear about it from the business side. What does poor initiation mean in terms of patient lifetime value?
Patient lifetime value is lost, or built or lost early, right? Every patient who delays or misses a first dose shortens the time on therapy. Early drop off dramatically reduces fills, persistence curves, and downstream outcomes. And for chronic or specialty biologics, that can mean losing, months or even years of potential therapy. And when patients, fall off before or shortly after the first dose, brands aren't just losing revenue, they're losing the opportunity to demonstrate clinical impact.
So when we're sort of talking about patients that will sort of fall off these therapies before they even begin, and we talked a little bit earlier about what Noble is doing with their program with the remote digital kits. So I would like to know just outside of what you guys are working on, what does onboarding typically look like for these patients otherwise?
Yeah, Megan, it's very mixed at the moment what patients are experiencing. The research that we've done has shown that greater than 50% of patients are reporting that they did not receive any training. Right. So every label for a self-injectable medication requires that, the HCP performs some level of training for patients, but we just know that it's just not happening or that patients perceive that it's not happening or that it's not enough, right? So we're leaving this kind of structural gap in the system, which means that patients, we're just not building that confidence in them to be prepared to perform that self-injection. So, to get back to your question, what does it look like? It's very mixed, right? It could be that a patient does get training from an HCP in clinic or from a nurse. It could be that they get it at home from a nurse supported by, a particular brand. But more often than not, what we're seeing is patients are left to their own devices, right? They're maybe reaching out to a friend or a family member who's, a nurse or a pharmacist. They're going to YouTube, to try to see what they can find there for how to do it, right? But again, most patients are kind of left to their own devices to figure this out, and that's just not a great way to provide a good standard of care for patients.
Agreed, because it just creates sort of this dangerous scenario where either patients are not getting the right information they need or they're seeking out someone who's maybe not the most experienced. And of course, we always have to take into consideration their own history and what medical issues they may have that may impact them differently. So, pivoting to more of the Noble SureStartRx, how do you address those challenges?
So, Noble is the global leader in creating, training devices, right? So devices that, mimic the look, feel, function of an auto-injector pre-filled syringe. We've created these devices primarily, for use in clinic with the doctor. But what we're kind of moving towards now is we're seeing kind of a market open up for more of a direct-to-patient support model. So what we've kind of built around our kit is it's very much centered around the physical training device, which is resettable, reusable for patients. But also, there's other physical assets that go into the kit that make it kind of a very tactile experience for patients to really get a good understanding of what that's like. But it's also surrounded with a digital ecosystem that allows patients to see videos, to look at tutorials, to get FAQs, and even to get access to, other digital assets that the brand may support.
Great, thank you. And I want to dive a little bit more into the kit. It seems like it has a lot of options for patients to really learn about what they're taking and stay on a consistent path. So, what makes that so impactful?
Yeah, so I mean, as I mentioned, the physical training device, we see in our research is, patients are using it, repeatedly before first dose, right? It just really gives them that comfort of, how do I hold it? What should I be looking at? How long should I hold it down, when I apply pressure to it, to perform the injection? So, we're kind of building this. Repeatable set of behaviors and patterns that a patient can go through to really feel confident to perform those self-injections. But what we're also seeing with the digital assets that we're creating is patients are coming back again and again for kind of second dose, third dose. Often the cadence for some of these products is, once every 2 weeks, once every 4 weeks, could be once every 8 weeks. So there's a big decay in learning over time between those windows when patients are supposed to be taking self-injections. And again, we see them coming back again and again to refamiliarize themselves with the process.
That sounds really great, and it can just really cement all of this stuff that we're talking about, like the insecurities patients may have with taking a drug, lapse in care, how this affects the chain basically from pharmacies to the patient directly. And I want to go back to something we were talking about earlier with the operations question being specialty pharmacies. So, why was specialty pharmacy such a critical channel in this program?
So we really see specialty pharmacy as the linchpin in this program. They touch every patient who goes on a self-injectable. And the way we've set the program up is that the patient receives the Noble SureStartRx training kit along with their first dose. So we've really kind of embedded the program into the specialty pharmacy clinical workflow system to ensure that, patients are getting the right training at the right time, which is with that first dose so that they're able to build high levels of confidence as early as possible.
That sounds great. And thinking about this, I want to get into a little bit of the numbers, make it a little crunchier. So, what has the research shown from all of these like different steps and having this digital sort of ability to test out medicine beforehand, like for patients?
Yeah, so even beyond the digital, the first thing that we wanted to demonstrate was, could we do it, right? So like the program that I was just talking about, or the workflow that I was just talking about, and being embedded into specialty pharmacy and their clinical workflow systems and inventory systems and tech systems, et cetera, et cetera. We wanted to ensure that we could do that. We've run, several programs to date. Those programs are being, kind of deployed as we speak. So we were able to kind of, embed into that process to make it seamless for both, pharma as our client, as well as, patients who are receiving the training kit. The next thing we were kind of curious about is, well, would patients use it, right? So it's up to them in this moment. They're on their own, at home, sitting at maybe the kitchen table with their medication and the training kit, would they use it? And what we found is that, over 88% of patients reported that they use some asset, from the training kit, whether it's a physical item or a digital item, to support, their onboarding to their medication. So now we know that patients are using it, right? Kind of willingly, they're kind of drawn into and using the components of the program. Now we wanted to know, was it making a difference, right? Was it changing medication taking behavior? And we found that it did, right? So patients were taking that first dose about 3.5 days sooner for those who had the kit than those who did not. And we found better adherence at the first refill. We found better persistence overall to the tune of about 1 to 2 more doses per patient over a 6-month period. So, not only were we able to, embed ourselves into that kind of that workflow that made this, that enabled it for a patient. Patients were using the materials, and it really was making an impact on medication taking behavior.
Those are incredible numbers and really speak to how having this instruction can be so helpful for patients. So, Sean, before we wrap up here, I wanted to ask you very directly just what is the ultimate goal of the SureStart RX program?
Very simply put, Megan, our goal is to enable patients to start sooner and stay longer on therapy.
Today's conversation especially has made one thing clear, which is that patient confidence is not a nice to have, it's rather a driver of initiation adherence and lifetime value. So Noble SureStart RX demonstrates what happens when confidence is designed into the onboarding experience as opposed to some of the more gaps in care that we've talked about. Patients start sooner, they stay engaged longer, and move into therapy with fewer barriers and less fear. The exploratory program reinforces a powerful idea, protecting the first dose, and you protect the entire patient journey. I want to thank you so much, Sean, for joining me today. If any of our audience members would like to learn more about Noble SureStart RX and how patient confidence can transform outcomes and economics, you can reach Sean at sean.glynn@gonoble.com. This has been Megan Manzano, Senior Custom Content Specialist for Pharmaceutical Commerce and Pharmaceutical Executive. Thank you, everyone, for listening.